How are you doing, guys? It's Ed, the osteopath at the Movement and Wellbeing Clinic. I hope you're all well and staying safe. So for this week in our rehab program, we're looking at wrist pain, more specifically Quervain Tenosynovitis. It's an absolute mouthful, but what we're here to do is tell you how you know you have it and how to fix it through exercise. So first of all, what is it? Quervain Tenosynovitis is a painful tendon entrapment and thickening around the outside of the thumb in this region. It affects 1.3% of men and 2.5% of women. Typically the age range is 40s and 50s. Again, usually it's worse after you've been doing lots of movements involving the wrist, whether that's work, screwdriver work, using vibrating tools. Basically any repetitive task that involves the wrist. So how do we know we have it? We start getting pain, numbness, tingling, clicking, popping around this part of the wrist here, and it typically comes on very gradually after you've been doing some repetitive wrist movements. That can be screwing things, or that can be using vibrating tools, or even just working at your desk a little bit too long. So the way we know we have it is doing something called Finkelstein's test. We bring the thumb to the palm of the hand, close the fingers round, and only deviate, or bringing the fifth knuckle to the ground. And you should feel your familiar symptoms here. That could be pain, pins and needles, numbness, or anything else that you're feeling. So now we're going into the exercise rehab. So if any of these exercises provoke your pain over 40%, or you generate 80% fatigue in that whole region, that's when you stop with the exercises. And finally, don't forget to do them on both sides. Best of luck. So the first exercise for week 1 is Thenar muscle group stretches. So we want to stretch the thumb in this way, the twist. And we also want to stretch the thumb, twisting the other way. Finally, you want to stretch the wrist down as much as you can handle. So the second exercise of week 1, eccentric hammer curls. So we get an appropriate weight and we slowly bring the weight to the ground, and you help yourself bring the arm back up. So for stage 2, weeks 2 and 3, we get an elastic band, putting them around the fingers and thumb as we slowly try and open the hand. Now this should give you a little bit of pain, but as long as it doesn't go over 40%, continue doing them. So for stage 3, weeks 5 and 6, we bring the wrist into extension and flexion, keeping the forearm completely straight. And then also for stage 3, weeks 5 and 6, we do supination and pronation. Bring the palm up and all the way down, again keeping the forearm completely straight.